One of my biggest motivations for going into psychiatry was actually that I get to spend more time with patients than anybody in any other specialty. So I have the chance to really get to know my patients well and on multiple levels, and that really appealed to me, hearing about their backgrounds, trying to help them cope with life stressors and some of the challenges that life presents to them. Being able to help patients as well as getting to know them on a very personal level, helping them overcome challenges in life to help them be productive people and to really maximize their potential in life. Intelligence is very important. In psychiatry, being a team player is also very important, as I think we really exemplify systems-based practice. There are multiple people that we interact with in taking care of many patients, so being a team player is extremely important. Having common sense is important. Being able to really apply the knowledge that you learn in a very practical setting is important as well. It really depends on the individual and how much time you want to spend working. There are jobs that are able to facilitate banker's hours. I'm certainly not in one of those jobs, but there are times where you can get a job that is much more limited time-wise and doesn't have much call associated with it, but if you want to spend more time working, there's certainly plenty of work to be had. Overcoming stigma is probably the biggest challenge facing psychiatry as a whole, both in terms of the patients and their ability to talk about their mental illness, to get insurance coverage for mental illness, time off from work for their illness, and people still are very reluctant to talk about their mental illness as opposed to saying that they have breast cancer or leukemia or something along those lines. And there's also stigma still in the medical field as well related to psychiatry. Patients may not want to tell their primary care physician that they're depressed and may use euphemisms instead. I'm very stressed, I'm anxious, I've got back pain, instead of talking about their depression. And even in some of our applicants talk about being discouraged about going into the field of psychiatry. So stigma is still rampant. The biggest thing students should know is that their time spent in medical school is extremely important for the field of psychiatry. I remember being told when I was talking to some of my professors about interest in psychiatry that I shouldn't be wasting my time in medical school if I wanted to go into psychiatry. And I am here to say that my time in medical school was very well spent, and I used the medical knowledge that I learned both in the classroom and in my clerkships every day. And it's very important to have the medical background in the field of psychiatry today.